Africa faces significant challenges with health and disease, which greatly affect its ability to develop and provide for its people. The continent struggles with a heavy burden of diseases and limited resources to tackle these problems. This situation is made worse by natural disasters, economic struggles, and conflicts. As a result, Africa's health indicators are worse than other parts of the world, impacting the continent's development. One of the most significant health challenges in Africa is HIV/AIDS. The disease originated in the early 20th century and remains a major public health issue. Although Africa has about 17% of the world's population, it carries a large portion of the HIV/AIDS epidemic. In 2023, about 25.6 million people in sub-Saharan Africa were living with HIV, which is over two-thirds of the global total. Eastern and Southern Africa are particularly affected, with about 55% of the world's HIV-positive population. In countries like Botswana, Lesotho, Malawi, Mozambique, Namibia, South Africa, Eswatini, Zambia, and Zimbabwe, over 10% of adults have HIV. This has significantly lowered life expectancy by as much as 20 years in the most affected areas. On the other hand, North Africa, West Africa, and the Horn of Africa have lower rates, possibly due to different cultural practices and less risky behaviors. Efforts to fight HIV/AIDS include providing antiretroviral therapy, ART, which has improved the lives of people with HIV and reduced deaths. From 2010 to 2020, AIDS-related deaths in sub-Saharan Africa dropped by 43% because of increased access to ART and programs to prevent mother-to-child transmission. However, challenges like stigma, poor health care, and lack of funding remain. Ebola is another disease that has caused problems in Africa. Ebola outbreaks have occurred in West and Sub-Saharan Africa since 1976. The disease remains in these regions, while it has been eliminated in other areas. The ongoing outbreaks are due to social and environmental issues, especially in Liberia, Sierra Leone, and Guinea. Lack of resources and poor leadership contribute to the spread of the disease. Ebola spreads through close contact with blood and bodily fluids, like saliva, urine, sweat, vomit, and possibly semen. It can also spread through contact with infected animals or contaminated objects like clothes and medical equipment. Symptoms include fever, fatigue, muscle pain, headache, sore throat, vomiting, diarrhea, rash, internal bleeding, and kidney-liver problems. The disease is diagnosed through lab tests, and public health officials are notified to isolate and trace contacts. Ebola has had devastating effects in sub-Saharan and West Africa because of its high death rate. In these regions, about 70% of Ebola patients die. Malaria is another major health issue in Africa. In 2020, there were about 241 million cases and 672,000 malaria-related deaths. The malaria parasite has a complex life cycle involving mosquitoes and humans. Africa has some of the most efficient malaria-carrying mosquitoes, such as Anopheles gambiae and Anopheles funestus. The dominant malaria parasite species in Africa, Plasmodium falciparum, is the most lethal and causes most malaria cases and deaths, especially in children under 5. Several factors contribute to the persistence of malaria in Africa, including poverty, human movement, resistance to treatments, and climate change. Poverty is both a cause and a consequence of malaria. The disease will remain a problem if the socioeconomic status of affected communities is not improved. Africa's growing population and high mobility also contribute to the spread of malaria. Despite these challenges, there are efforts to improve health in Africa. Organizations like UNAIDS, the World Health Organization, WHO, and the African Union are working to coordinate responses to HIV/AIDS. Programs like PEPFAR and the Global Fund have helped increase the distribution of ART and prevention campaigns. The WHO and partners have campaigns to re-energize efforts to eliminate malaria. The African Union has set a theme of justice for Africans and people of African descent through reparations, calling for action. Addressing health and disease in Africa is crucial for the continent's development. By improving healthcare, addressing socioeconomic factors, and promoting education, Africa can improve the health and well-being of its people and move towards a more prosperous future.